coronavirus tally has crossed that of China's, but there is still no respite for us from the pandemic. In times like these, India is aiming itself with ideas and innovations to fight the outbreak. It's not only engineers and doctors, but also students who are pitching in to make the best use of the technology.
Some of the purely self-reliant inventions in the field of medical are as follows. CoviSafe, transporting patients. Doctors in Nagpur innovated CoviSafe to ensure the safe transport of COVID-19 patients. The box fits well on medical stretchers and is completely airtight. Emergency facilities like oxygen and ventilators can be easily installed on the box. Most importantly, when the coronavirus patient breathes, the air that comes out of the box is filtered. The idea is to help keep doctors and healthcare staff from getting infected. Sanitizer tunnels. A Jugaad, a nodal officer from Chikkaballapur district, set up India's first organic disinfectant tunnel on the main road of Gauribidanur town. The unique idea that is synonymous with the Indian Jugaad was built in just 2 days using local materials and workforce. The first of its kind tunnel uses an organic fumigant instead of sodium hypochlorite, is 20 feet high and was completed with polythene sheets. Meanwhile, Telegon Dabhade Municipal Corporation authorities came up with another Jugaad innovation. A wash basin in their premises was modified in such a way that one need not touch either the hand wash bottle or the pipe, instead push a lever by foot. A similar wash basin has been developed by the Barvadi Vargan Care Center of the Dhanbad Division Indian Railways. It allows the water tap and the soap dispenser to be mechanically operated without touch.
A startup based in Kerala has deployed robots at entrances to office buildings and other public places to dispense hand sanitizers and deliver public health messages about the virus. Robots developed by Asima Robotics are also being deployed in hospital isolation wards to carry food and medicines, which eases the pressure on the medical staff.
Rother. The low-cost frugal innovator engineers at Design Innovation Center DIC of Islamic University of Science and Technology, along with a team of engineering students from IIT Bombay, have created a prototype of a low-cost ventilator and named it Rother. Medical experts at SKIMS are soon to set it up and evaluate it, which is working successfully in the laboratory and cost the team around Rs 15,000. In response to the shortage of ventilators for critical care, startups such as Noka Robotics, Aerobiosis Innovations, and Agua Healthcare are developing low-cost, easy-to-use and portable ventilators that can be deployed even in rural areas of India. These ventilators would need medical regulatory approval before they could be deployed. Jiva Setu ventilators. Innovators at Reva University and Bengaluru have invented an oven-sized, low-cost and portable ventilator. The Chancellor of Reva University launched Jiva Setu ventilators with the resident staff and aid the medical infrastructure of the country. It is expected to deliver 500 to 600 ml of air per breath and 15 to 18 breaths per minute, as specified for COVID-19 patients, said Dr. P. Shyama Raju, Chancellor of Reva University. Not just ventilators, Reva University has also made masks and supported the community, submitting proposals to the government to partner them with ideas and innovation.
A similar initiative has been taken up by a Rajkot-based industry that developed a one-of-its-kind, fully automatic machine that produces N95 masks in bulk.
Low-cost PPEs, the Navy's innovation. A doctor in the Indian Navy has developed a low-cost PPE that helped Indian Navy acquire a patent in association with the National Research Development Corporation (NRDC) an enterprise under the Ministry of Science and Technology. It is made of a special fabric with high breathability, which is suitable for hot and humid conditions prevalent in India. The technology has been validated by ICMR too. The mass production of this PPE is currently underway with the team of innovators from the Navy working in close coordination with IPFC, set up under the mission to Raksha Gyan Sakt in 2018. Arogya Setu. In early April, the Indian government launched a COVID-19 tracking app called Arogya Setu, which uses GPS and Bluetooth to inform people when they are at risk of exposure to COVID-19. The app was launched before a similar initiative from tech giants Google and Apple got off the ground.
Go Kerala. The Kerala state government launched an app called Go Kerala. It sends COVID-19 updates and travel information via phones and via SMS. It delivers messages in both English as well as Malayalam, the local language.